No, my background and everything. I mean, most of you have been on set in on other trainings and kind of familiar with my background, or at least part of it here. So let me see. What I'm going to talk about here today is several different dimensions of trauma, and and I've talked about this in the past, particularly in relationship to children. And I'm going to do some of that today, but I'm also going to talk about, trauma issues as they relate to parents as well here. So I do invite you to, make comments, ask questions, put something in a chat box, just interrupt in some kind of way if you want to. And hopefully every few minutes here, I'll stop and give someone a chance to make comments and so forth. So obviously, this is a big subject and has a lot of different dimensions and obviously, we're not going to cover all of what could be said or what ought to be said about this subject today, but hopefully going to cover some of the fundamentals here and then talk about some of the applications, particularly the practical applications for working with children that you represent as CASAs and also, helping you to understand some of the issues that the parents have too as well here. So I guess the first thing I want to say is that in the last maybe 15 years, trauma has become one of these, much used, I would say overused kind of words that because it's used so frequently in so many contexts by so many people, it's like a lot of words that start to have, because of their overuse and misuse, they start to have kind of vague meanings and so when people talk about trauma, a lot of times, whether it's within a child welfare context or in some other, not always quite sure of what they're actually referring to here. And so we're going to talk a little bit here about maybe the difference between one trauma on one hand and suffering in the larger scheme. We're going to talk a little bit about the distinction there and also about the distinction between trauma and adversities in general. So this is just a sort of a definitional kind of an issue here. So very common for, people that I hear sometimes people, artists, sometimes writers, sometimes scientists use trauma and suffering as kind of synonyms, like if people have had very difficult backgrounds or they've had very hard experiences of various types and people have obviously suffered in all kinds of ways, then sometimes that's just referred to as, having histories of trauma. And of course, sometimes that's really true. And at other times, it's just probably a little bit of a misuse of the language. There can be a lot of painful things happen to people in life, and I imagine a lot of you, like me, are up in years, and a lot of painful experiences have occurred. And maybe some of those have had elements of trauma, as I'm going to talk about it here, and some have not. Some have just been plain old difficult. Um, so, for example, I've had a lot of dental work in life, and I've had a lot of that's been pretty painful stuff. But I wouldn't go around talking about a lot of physical ailments that I've had, even ones that caused a lot of pain, as being an instance of trauma. And that would be true of a lot of emotional suffering as well. I mean, there's lots of things that are difficult in life, painful. We wish they didn't happen. We live through them. We have some kind of memory of them, but it wouldn't be necessarily right to talk of them as traumatic. It'd be almost like a misuse of language to do that. So when I talk of trauma, I'm talking about the kind of suffering that involves two main elements. And the first element is terror. Someone is afraid for their life or for their physical, usually their physical well-being, and a lot of times for very rational reasons. And it also means that feeling of terror combined with the experience of powerlessness. That is, there's nothing I feel I can do about it. So the normal response, of course, to very painful, difficult kind of experiences if we can, particularly in anything that we regard as a threat, the usual human response is to either flee or fight. We either try to get away from the threat or we're going to actively oppose it in some kind of way. And so a lot of times then what's going on in traumatic experience is that that fight or flight response is impossible for various reasons. I mean, sometimes to fight back would be to ensure one's death. I mean, in certain types of situations. And in other situations, it just is completely and totally pointless. I mean, how does, for example, if you're stuck in a natural disaster and you're trying to stay alive, what does fighting back mean exactly in that situation there? So sometimes we're able to flee, other times we're not able to flee at all. And so the idea of trauma is then because you can talk about human beings having a sort of a built-in, almost genetic apparatus for dealing with threat. When it's impossible to employ that apparatus or those strategies, if you like that language better, then the issue of trauma comes to the fore here. And even in those situations, people's reactions to those experiences is really quite variable, and particularly in response to acute trauma. So, very difficult, horrible things that happen to you once. And they might have been life endangering things. I mean, my guess is that many of you who are in your even 30s, 40s, 50s, 60s, at some point may have had a scary kind of car accident or some other kind of accident that really endangered your life and that you felt in retrospect you really could have died there. And I've had it like my guess is most of you. I've had a number of those kind of experiences, and so I sometimes I wonder how is it that I could have lived, when any number of things could have killed me over the years, right? As my guess is, it's also true of you, right? But I'm many of those experiences, they're one-off kind of things. I mean, stuff that could not have been predicted or sometimes due to carelessness, all kind of things happen there. So lots of very difficult, painful experiences, which at least have the potential to be traumatic. That is, and the potential to be traumatic, to say this one more time, is when experiences have these two elements. That is, they inspire terror and you are powerless to do anything about it. It's that combination. Okay, um, so I would say probably after one is 40 years old, I would be very surprised if anyone lives to be 40 that doesn't have some of those, at least one or more of those kind of experiences. So it turns out that when it's the one-off kind of thing, even when it's really horrible, people's reactions to those experiences are really quite variable. So there were, in the wake of or in the aftermath of 9/11, if you remember, as obviously all of you do, the terror attack on the buildings in New York City. So if you remember that, then you will probably remember that there were schools that were in the vicinity of those buildings and where these, young students, kids really witnessed those towers coming down. So in the aftermath of that, then there were several studies of the incidence of trauma symptoms and among at least some of those, a sample of those students, a lot of whom were, first, second, third graders, something like that, as well as older. And the surprising finding in, several of those studies were that the percentage of children who had trauma symptoms there was surprisingly low. It was not most of the students, it was a very much of a distinct minority of the students. Some of the trauma symptoms were quite severe, a lot of them weren't. And it turned out that there was a very straightforward kind of predictor, kind of a common sense predictor of which children who had any kind of trauma symptoms at all, and I'm going to talk about trauma symptoms here in just a minute here, but who had any symptoms of PTSD at all, which of those children would be quickly receptive to treatment or therapy and which would not? So, what do you think that common sense predictor was in these studies? What do you think predicted which among those children would make a quick recovery and which children had difficulty in making any recovery at all? What do you think? Well, perhaps not a surprise here is that the children who had really solid, substantial parental support, parents who were empathetic, caring, nurturing, all the kind of stuff that you like to, the kind of adjectives that we apply to good parents. So those children, if they had PTSD symptoms at all, they got over it fairly quickly. And children who had less visible support, and I don't remember in the studies what the measures of that were. I mean, it'd be good if I did, but I actually don't remember there. But the children who had less visible, obvious support had more difficulty kind of in recovering there. So kind of a common sensey kind of thing there. Okay, so a lot of the trauma that people experience in life is these acute one-off kind of things. But there is also people, including lots of children that we deal with in child welfare, who experience chronic traumas. That is, traumas are repeated over and over again because kids are either being seriously physically abused or they're being seriously neglected in their very early years, or they're being sexually abused over some period of time. So that's a completely different kind of a deal. The difference between acute trauma and chronic trauma, a major league kind of dividing point here. So the more that trauma is chronic, the less likely people are going to be able to experience and come out with no obvious symptoms. I mean, sort of in a straightforward kind of way. But then there is within the treatment literature on trauma, there is a third kind of trauma that, of course, applies directly to child abuse and neglect cases, which is complex trauma. So complex trauma is chronic trauma that is inflicted by a caregiver or caregivers. So not only is the abuse and neglect chronic, that is, it's periodic, it goes on, it's not a one-off kind of deal, but it's also inflicted by the very persons in a child's life who are responsible for that child's safety. And so it's complex trauma. And then to make it even sort of more difficult in child welfare, of course, a lot of the kids that we deal with in child welfare, as I've mentioned before in these trainings, about a fifth of the children who are entering foster care are entering in the first year of life. And almost half of children who enter foster care at all for longer than a few days are entering care in the first 5 years of life. So a lot of children experience trauma then, chronic trauma, complex trauma, but at a time before they have language and before they can encode that experience in verbal memories of any type at all. So a lot of times kids then who, as infants or as toddlers before they had language, went through these kind of experiences, they may have a lot of the reactions, a lot of the symptoms of trauma, but they have no memory, they have no reference to go back and to connect it anyway. And that is another dimension of trauma. And of course, it's a very much of an issue in treatment and very much of an issue for therapists who cannot, there's no way that they're going to be able to at some point access those memories of trauma because kids don't have verbal memories like that at very, very young ages. So some for example, treatments of PTSD really are various ways of getting folks who have trauma histories to be able to gradually construct what therapists call a trauma narrative. That is a continuous sort of story that has a beginning, middle, and end. And so there was a time probably 15 to 20 years ago when most trauma therapists believed that developing a trauma narrative was the almost necessary, most urgent part of trauma treatment. That's no longer the case for a lot of people in the trauma field, but there was a long period of time where it was almost viewed as the essence of trauma treatment. But obviously, completely impossible for very young children who don't have those kind of memories. So there is, by the way, if you want to look at, for those of you who are old enough to remember The West Wing, and some of you may have been, people who followed that show was on for years and years, and you probably can still find it and still interesting. And so there's an episode in the second year of The West Wing it's episode 10 called Noel. And I used to use this when I taught classes at the University of Washington School of Social Work, and I taught trauma classes, and I would use this episode, which is about 45 minutes in length. And it describes a presidential staffer who is nearly assassinated, shot, almost dies during an assassination attempt. And it shows sort of the aftermath of that as he begins to act weirdly and strangely and in a way that's very distressing to his colleagues, and who nevertheless recognize what's going on with him, but of course he does not recognize it. And so the underlying theme of this episode is that in a single day, the people who care for him within the White House, remember this is the sitcom kind of thing, they bring in a trauma therapist who within a single day, a Saturday, I believe, over a period of 8 hours, gradually get this guy, this brilliant staffer, to talk about what happened to him. And of course, he's involved in all kind of denial and lying. And of course, just like you find in child welfare, there a lot of times isn't a clear demarcation between denial and lying. It's, to say the least, a fluid boundary. But this guy, this man, is engaging in both of those. And of course, he's very arrogant. He's doing whatever he can to put off the therapist and to make fun of the treatment process. And so this show within 45 minutes does a really good job of showing what was the thinking about trauma treatment at that time, which was to get people to simply remember what happened to them accurately without any kind of denial about it, and be able to reproduce that in a simple verbal story. And as simple as that sounds, not simple to actually do, if one's way of coping in life has been to just suppress the whole thing to the extent possible. So the famous Judith Herman book, Trauma and Recovery, if any of you work in human services, I mean, as a professional, if you earn money, helping people, and in the course of your professional studies, you haven't been assigned to read Trauma and Recovery, someone has wronged you. So this book came out in 1993. It's in paperback. It's wonderfully well written. It's been translated into probably 40, 50 languages, or maybe even more. And so I think the very first sentence of this book, the author Judith Herman says, basically she says in so many words, what everyone does initially with trauma is they try to bury it. I mean, that's almost the universal, I won't say 100%, I don't know if anything's 100%, but as universal a reaction as you can get. The first response to trauma usually is just bury it somewhere in the memory, and if at all possible, just forget about it and don't ever talk about it. Don't ever acknowledge that it's influencing you in any way. Try to forget what happened. Um, and so that's why in the initial stages of treatment, a lot of times a really deep resistance, a deep, deep resistance to recovering these very, very painful memories of being both afraid for one's life and powerless at the same time. Right. So now what's happened over the last 15 years or so in terms of Trump, there are a lot of changes because of just a huge amount of work that's been done in this field and a lot of really, really excellent work. So probably about 10, 11 years ago, something like that, Bessel van der Kolk published The Body Keeps the Score, which this has been on the bestseller. I was looking at the New York Times bestseller list recently, and I'll be damned, that book was still on the bestseller list after 10 to 12 years or so. And so at the time that it was published, there was probably the most up-to-date account of kind of new thinking and trauma treatment. And one of the themes of that book is that both the effects of trauma show up in all kinds of ways, but especially physically, and in terms of the body, and in terms of how one feels, literally in one's physical being. Um, and so, one of the themes of The Body Keeps the Score is that the main thing that trauma victims need a lot of them, they need to feel safe in their own bodies. To say that again, even before thinking about a trauma narrative in trauma treatment, the main theme a lot of times is, well, how to help this person to feel safe in life, beginning with safe in one's own body. Um, and of course, if you go back, I had mentioned the West Wing thing for a second, and one of the things that episode does is show how a person is who doesn't feel safe in their own body, who's afraid of their own mind, um, and who's afraid of their feelings afraid of what they might do, afraid of they might think, afraid of what they might feel. What is it like to live like that? That's really hard. And so, of course, the end result of that a lot of the times is that people come up with all kind of dysfunctional ways of dealing with trauma. Most obvious being the misuse of substances in various ways, right? Either painkillers or alcohol or sedatives or combinations of all of the above there, and other kinds of ways as well. So the classic sort of four symptoms of PTSD. So I'm going to talk about. So a lot of times when researchers, scientists, psychologists, people like that, when they do studies on trauma treatments, a lot of times for reasons that aren't completely clear to me, they will sort of narrow the concern with outcomes to the four major PTSD symptoms. And those four symptoms are intrusive memories and nightmares. So it's sort of like a reliving of what happened that can sort of just come out of the blue, or it can be, as I said, a nightmare, or it can just be it's sort of like what people used to say, either accurately or inaccurately, about the use of psychedelics. So there can be a reliving of those kind of experiences. The sort of other outward going symptom is hypervigilance, that is being extremely sensitive to any issue relating to threat. And um, so for example, I had definitely issues like this when I was younger, coming out of my childhood and in college and so forth. So there's one time a person told me, and I wasn't even aware of this. So I was doing it, but I wasn't aware of it. People was told me that the first thing they noticed about me that was I was always scanning the room. I was always scanning. My eyes were always darting from place to place. I was always trying to assess safety issues there, right? I wasn't aware of doing it. But other people, of course, noticed it right off the bat because it was seemingly odd and so forth. So that's the kind of hypervigilance kind of thing that I mean there. It's a sort of constantly being on alert. And it's, of course, and that is in and of itself a form of stress. And of course, it puts it's definitely a challenge to health and particularly a challenge to sleep. So people who have issues with hypervigilance are probably also going to have sleep disturbances, and sleep disturbances then have all kind of issues, effects on health, just a wide variety of effects there. So the inward symptoms are first numbness. So just, the inability to feel anything at all much, I mean, apart from pain. Um, some other people will have a very limited emotional vocabulary. So, for example, there's people, and I was one of these people years and years ago, I definitely could feel anger. I definitely was familiar with that. But I wasn't familiar with a lot of other feelings that other people were very comfortable with, right? So I had a, very limited emotional vocabulary. And with some people, there's even the inability to do that. It's just like sort of feeling a general kind of numbness. And of course, what happens as people begin to feel less numb is that they begin to physically hurt. So the whole point of the numbness there is a sort of a psychic unconscious way of controlling pain. And so one it's a defense. And so once people give up that defense, then they are going to begin to hurt physically as well as emotionally. And then they're gonna have to find some way of coping with that. And so a lot of the sort of the trauma treatments, I mentioned the Bessel van der Kolk book before, a lot of the trauma treatments that have been developed in recent years have to do with, they're sort of a plays on the theme of mindfulness. And so the all kind of mindfulness kind of exercises that various and sundry therapists around the world have mostly taken from Buddhism. I don't know where trauma treatment would be today in this world, particularly in this country, without Buddhism, because a lot of the treatment have come directly from practices that, have been discussed by Buddhists for thousands of years. And mindfulness is one of those kind of experiences there. And so that is sort of something that one practices, non-judgmental, and the non-judgmental I have to underline about 5 times, non-judgmental awareness of one's bodily states, one's feelings, one's attitudes, one's thoughts, without any kind of judgment or condemnation, with any kind of critical, just noting it, being aware of it. And sometimes, of course, that ability to be mindful in that way is supported by meditation or other kinds of practices that quiet the mind. But other people use other kind of methods. Some people are able to meditate, and others aren't. Some people, really need to physically move. And so for years, my wife taught a dance class that was curiously attended by a lot of kind of expressive dance. And so a lot of the people who were in the dance class were therapists who talk with people all week about their problems, and they just got tired of it, tired of all the talk. And so they wanted some way of expressing themselves in a nonverbal kind of way. And so they signed up for dance, right? So I guess what I'm trying to say, there isn't one way to be mindful. There are some useful ways, but it's something that, one has to find your own way and path there. And then, of course, the most concerning symptom of all in terms of the classic 4 PTSD symptoms is dissociation. And so dissociation is sort of a standing apart from oneself. It's sort of like a person who's being raped. being able to somehow leave her body and witness the event like she is or he is an observer. And the reason I say it's the most concerning symptom is because it appears to be the symptom that has the most long-term impact, negative impact on functioning. You know, as bad as all these other symptoms are, and they're all bad, the one that really affects functioning seemingly the most and leads to other kind of psychopathology is dissociation. And so Deborah Gray, who some of you have heard me mention before in these trainings, a therapist in Bellevue and now a retired person, and the author of Nurturing Adoptions and Attachment and Adoption, a couple of other books. She refers to dissociation as a catastrophe, a developmental catastrophe, because it undermines the sort of the sense of agency there. So on the good news kind of front here, the good news is that if you think about trauma in this narrow way, in terms of these four PTSD symptoms, there are lots of good evidence-based practices, and I mean several, for trauma treatment. So someone from that I used to communicate with a lot who used to work for WISP, the Washington State Institute for Public Policy, told me that she had done a comprehensive review of the literature of trauma treatment. This was at least a decade ago or something. And she did this stuff for a living all the time. And she said that she was astonished at the rate of success of trauma treatments if you looked at their effects on these four classic PTSD symptoms. So trauma is really something that people considered in this narrow way, people do really recover from, and at quite high rates, and through quite a variety of treatments. Now, sort of the cautionary note here, the caveat, is that the effects of trauma go way beyond these four classic symptoms. And I think maybe since I've been talking for a while, maybe before I say anything more, I'm going to stop here and see if you have comments or questions here.
So I don't know, Dee, if this is a question necessarily, and I suspect you're going to get to this, but as you're talking about some of the things like mindfulness, I can see to some extent how that works in young adult, or even in some cases with children. With younger children, it's not as obvious to me how things like that. So I'd be interested, as you talk about the different types of evidence-based approaches, how they change from very young kids to, maybe teens and preteens. And then also, how do you address this issue in treatment where kids may be acting out on something? You said they're not really able to verbalize it, and maybe they would never be able to verbalize it because it happened to them at a point before they were necessarily speaking or talking about these things. Does that change how symptoms and issues would be present and or how you would treat them?
Yeah, so let me, those are both important questions and big ones. And so let me say just a little bit about it, about both of them, maybe just a little bit here. So let's just start off with the fact that most children, who are certainly younger than 12 and maybe even after that, a lot of times if you talk with them about particularly about what's going on with them, say in the aftermath of a meltdown. And so if I've mentioned before, one of the sort of the main negative effects on child functioning of trauma histories is emotional dysregulation. And so that means the kids are very stress reactive, and I mean, any little thing might cause them to blow up. And then the tantrums, if that's what you want to call them, or the whatever you want to call it, I call it a meltdown, those can be very, very extreme. I mean, really, really extreme. And they're so extreme that they frighten the people around them, and at really pretty young ages. So I think probably in trainings here before, I've talked about the The Boy Who Was Raised as a Dog, the book that came out on trauma about 2000, 2006, 2007 that talks about this little 6-year-old boy in a Bay Area emergency room who, the author of the book encounters, and the kid doesn't have any language, and he's on all fours and covered in food and feces and so on, and right. And so and this turns out that this kid has had this extreme history of neglect, and so it doesn't have any kind of language at all. So with very young kids, a lot of times the place you have to start before you can ever talk about mind, you have to help kids with emotion regulation. And the sort of the issue there, and the reason that the Deborah Gray books are so good is because they have practical advice for how to do that with kids of all ages, from infants through late adolescence. And obviously depending on the kid's developmental status. That is, so obviously it would be a big difference whether if you can talk with a child, even in a rudimentary way, about what's going on with them. I'll say something about that here in just a minute. That's one thing, but what if you can't do that? And so the advantage of the Gray book is that she has very concrete ideas, very doable, practical things that foster caregivers and adoptive parents and parents at times, after kids are reunified, practices and skills that can be used with kids around the emotion regulation kind of issue. And that's where with kids you have to start. And so when I do training on chronic neglect, or I do training on developmental consequences of abuse and neglect, I always start with this one because there's a whole range of consequences. I mean, a large range, almost from A to Z. But you have to start with the one that has this devastating effect on development, particularly on the capacity to function in school. And so you start off with issues related to emotional regulation there. And I've talked before about some of the skills that are involved there, but a lot of those are very simple skills. And for example, they have to do with breathing. And so whether you're a very young child, there are turns out Head Start programs in this country, even as a decade ago, had begun to use breathing kind of exercises at nap time for very young Head Start kids. I mean, all of them, not the ones who had trauma histories, but all of them, because very young children can learn those exercises. Breathe in slow through the nose, exhale through maybe I've got it the other way around. It's so the idea is to slow one's breathing, to take deep breaths, and as a way of self-calming. And so, of course, what you're trying to help kids to do initially is you're trying to help them to calm down. That's the first most important thing that has to happen for them to socially function in the world. They have to be able to do that. But at some point, you also want them to be able to recognize triggers, and particularly as they get triggers to these meltdowns. So even if you ask most kids almost at any age, whether they have language or not, what caused you to go off? What caused you to start hitting and scratching and biting and saying horrible, nasty things to everyone around you and frightening the shit out of everyone in the vicinity? And the usual answer would be that the child has no idea. They had no idea what it was, right? So what happens then in trauma treatment is that because someone is with a child regularly, a lot of times, for example, in a daycare setting or in a school setting, and they're able to observe the child in their social interactions. And at some point in these social interactions, something is very threatening to that child. And so through careful observation, an observer, a skilled observer, and this could be a foster parent, it could be a parent, it could be a teacher, they're able to recognize what that stressful thing is. And a lot of times, obviously, it's more than one thing, but the idea is to be able to then to help the child to construct their own trauma narrative there. So even by the time of the child is maybe 3, 4, 5, a very sensitive, competent observer can begin to help the child to recognize what happened to them. That is, you were playing with this toy and someone came and grabbed it from you and you looked at me and I didn't pay attention and you became very, very upset and then you became more upset. So gradually, the people around the child have to be able to recognize what's going on and then to help the child to understand that little by little through repeated episodes. So the way kids learn emotional regulation, it's not through some dazzling amount of insight that a therapist has, like on a Law and Order show or something. I mean, it isn't like that. And it wouldn't be like that, by the way, for an adult either. It's that the way you learn emotional regulation is through practice, through repeated episodes. And that usually means for most of us that we have to fail at that some. And kids, it means they have to fail at it a lot. And so little by little, as they learn to recognize their triggers, and hopefully they begin to acquire ways of calming down, then they began to get control of their, so to speak, emotional switches. And that is what happens, by the way, in normal parenting with babies crying. Kids get dysregulated in various kinds of ways. They signal their dysregulation through crying. Parents are hopefully emotionally responsive to what's going on with the child. They help the child calms down. So that sort of cycle of need and then response and then calming over and over and over again builds hopefully a relationship of trust there. So you start off with kids, any kid, any age, with issues related to emotional regulation. And little by little, as you then teach them how hopefully some self-help skills for calming down, you begin to introduce simple ideas around mindfulness. And the most simple ideas that for most of us is to pay attention to our breath. Start off with some sort of simple kind of a breathing exercise kind of thing there. There are some children, as I mentioned, I think last time, who can be helped by touch. But there's a whole bunch of by hugs and by physical reassurance and by holding. Um, but there's a whole bunch of kids who have trauma histories for whom touch is toxic, is threatening, is dangerous. So one of the things that caregivers have to learn, and I mean, this is also teachers and childcare providers and so forth, is whether a young child can actually be calmed by touch or whether touch to that child because of their history is extremely threatening. That would be another example. Another kind of common kind of skill or strategy that the folks who are trauma informed use with kids is that they tend to use time in rather than time out. So when children are misbehaving and they have to be disciplined in some way, some kind of response to behavior, instead of isolating them in a room or something, then the tendency is in trauma treatment, a lot of times the theme is staying with the child time in during the time that they are emotionally dysregulated, because the whole point is here is that the kid is out of control. And so to give them some kind of sense of security, they need the proximity of someone who's powerful enough to actually control them, but kind and loving enough not to hurt them. So obviously you can control someone by hurting them. I mean, if you're, a lot bigger than they are and you don't care about their feelings. And of course, in the absence of trauma-informed care for children who are in the youth who are in some kind of incarceration, or they're in juvenile detention facilities, or they're in sometimes just in plain old foster care. In the absence of trauma-informed care, at some point in response to meltdowns, someone will hurt a kid, either inadvertently or quite deliberately, in order to make the kid, just stop, make the kid just stop. Whatever. And of course, that will then exacerbate the trauma. So you go from whatever caused the trauma in the first place to, caregivers then having a response to trauma that then exacerbates it and so forth, right? And so that's why so often, just in, a comment here, some kids, I think it's become obvious in this state in the last few years, there are some kids who are violent that really do have to be locked up. That really is a necessary thing for some group of kids. But so somehow this sort of the ideal that we're going to treat all youth and we're never going to use lockup or incarceration or something, I mean, that's just been shown to be exceedingly dangerous. And so, but at the same time, when you have these lockup facilities, I mean, the worst thing that can happen is that kids get physically abused or sexually abused in those facilities, and sometimes by their peers, not just by staff, by their peers. So one of the main indictments of residential care in this country has been in recent years is that kids and a lot of times youth in residential care facilities or end up being bullied by older, bigger, stronger kids in those facilities. So their mental health problems are being worsened. They're not being treated, they're being worsened because of that kind of treatment. So that's the challenge that the sort of trauma histories pose for not only for caregivers, but for everyone who works with them is the symptoms can be quite dangerous and threatening and really um, very, very possible for, pretty young kids to hurt people during meltdowns or so forth. But if we want kids to get better, we can't control them by hurting them, just to say kind of the obvious thing there, right? Okay. So that's sort of part of the answer. You start off with issues related to emotional regulation, and then you help kids little by little to understand what's going on with them through careful observation. Through careful observation, so they begin then to be able to learn to use rudimentary self-calming approaches here. Now, most of us in life, I think, what time is it here? Without, because I'm going to run out of time here. There's a couple of other things I want to say. I think most of us in life, these issues that I'm talking about here in relationship to emotional regulation, calming, and so forth, they don't just apply to people who have trauma histories. They apply to all of us. These are challenges for everyone in life and at all ages. So it just happens to be that folks who have trauma histories, kids and adults, they just have been challenged in really extreme ways at a time when they didn't have the developmental skills or equipment, the understanding, even language to be able to deal with that at all. Um, and yet somehow we have to help them with developmental repair. So one more editorial comment, and I'm going to say one more thing here. So one of the reasons then, therefore, that child safety cannot be just about child safety. I mean, child protection cannot just be about child safety. I want to say this as emphatically as I can say it, because for kids who have been hurt by child maltreatment, we have to know something about developmental repair. We're not just on the hook for stopping the maltreatment, we're on the hook for helping the child to regain some kind of normal, quasi-normal developmental trajectory there. And that doesn't just involve evidence-based treatments. That involves the quality of caregiving, especially. And it is very, very affected by what happens after kids go home in reunification. And it's affected by what goes on in adoption. So as a society, we're on the hook for that. Why? Because we're taking these incredibly intrusive actions into kids' lives here, through child placement and through legal action and legal structure and so forth, right? So it's like the sort of another application of the saying, in for a penny, in for a pound. So if we're going to help abused and neglected kids, it's not just sort of stopping the abuse and neglect. It's a lot more than that. Now I want to say one other thing about, we're going to run out of time here, about the other effect of trauma. So I've already mentioned the major effect for kids is emotion dysregulation, and that's a big issue with adults as well. But even a bigger issue as far as the adults go is the compromise of agency, of a feeling of being able to do things in the world that are necessary for survival and necessary simply to live in the world there. The ability to act on one's own behalf. And so this is the really severe, damage that goes way beyond, it includes, but goes way beyond the four classic PTSD symptoms. When faced with challenges, it's the sense of paralysis. It's a sense of immobility. It's the willingness to give up very quickly when some faces an obstacle in life of any type. here. So one of the famous sort of findings from there was a longitudinal study done in Minnesota that started in either the 1970s or 1980s and continued for a period of years, and at least until the kids were grown. And so one of the findings from that study was that the kids who had been neglected at early ages in that study, they had the poorest problem-solving abilities of all the maltreated kids in the study there. And there were kids who were physically abused and sexually abused as well. But the reason they did is that when faced with an obstacle, they just gave up. They didn't keep trying to solve the problem. Because think about it from the standpoint of their life experience. Their cries when they were young, frequently, there was no response to those cries. The things that they did to ask for help from caregivers, there was no response to those pleas. And so at some point, they learned a very deep lesson here. And this is why a lot of times helping people, I mean, of all ages is so incredibly difficult because it's not just dealing with behavioral symptoms. I mean, as necessary as that is, it's also dealing with these dysfunctional beliefs. And a lot of times, sometimes the kids can't even articulate the beliefs. They couldn't tell you if you asked them, well, what do you believe about something? They wouldn't even know what you were asking them a lot of the time. Nevertheless, at very young ages, they have somehow acquired very deep beliefs about the world. And so one of those beliefs would be, if I cry, no one is going to come. That would be a simple sort of, it would be after repeated, maybe hundreds of, experiences of that over a period of years. Or if I'm hurt, no one gives a damn. That's a very painful lesson. That's one of the reasons why neglect has such long-term damages, such long-term damages on development and on life in general, because people at young ages acquire these beliefs about other people in general. Not necessarily because they're rational, because the beliefs can apply to everyone in the world, but they were acquired from experience with just a few people, and sometimes with only a single person. And yet it's very, very hard to undo those beliefs because they're based on this sometimes experiences that kids can't even remember the experiences. They just know they don't trust anyone. Um, so one of the useful things that when I taught MSW students, one of the things I tried to get them to do, and these were some very smart students, but they had a lot of trouble in doing this. They could understand the idea that we're going to do something hopefully about symptoms. They could understand the idea that we wanted to do something to help people with their personal relationships and so forth. But they just had a lot of trouble in going from symptoms to underlying beliefs. That is, what does this behavior say about the belief of this child? And that is what a competent trauma therapist ought to be able to do after an extensive amount of experience with children. And it's something, by the way, that I think most of the time very experienced foster caregivers or adoptive parents are able to do as well. After a time, you kind of know the underlying thought process. And so a lot of those beliefs are very, as I've already mentioned, very dysfunctional. Dysfunctional in the sense that they prevent one from dealing effectively with the world. And so they really need to be unlearned. But to unlearn, they have to be discredited. They have to be over and over again. There has to be the experience of it just not being true. So, for example, if I have the idea that I'm in pain, no one is going to help me. The way that belief is unlearned is just over and over again, when someone is in pain, someone helps them. And that can be an emotional pain as well there, right? So it's not like that kids are going to get some insight, verbal insight, and suddenly their problems are going to be like minor or something like that. No, it's going to take a long time. And that's why the idea of recovering from trauma, really, it's sort of the bad news here, I guess. It's a lifelong experience there. It's not just being able to manage or get rid of some PTSD, a few, 3 or 4 PTSD symptoms. Um, And it particularly has to do with issues of agency. So the parents that we deal with, sort of the last comment here, maybe I'll come back to this, coming month, and we can talk about this a bit more here. The parents that we deal with, particularly parents where there's chronic neglect or some combination of neglect and abuse and so forth, and there's going to be an underlying issues with drug and alcohol and domestic violence and chronic mental illness, as all of you already probably know there. Those parents have got issues of compromised agency. I mean, compromised ability to do things on their own behalf, right? Because that's the effect of depression. Depression is the most common symptom of trauma. So I want to say this again. Despite all the focus on these four PTSD symptoms that I mentioned before, the most common, long-lasting, deep-seated effect of trauma histories, of chronic trauma histories, is depression. And depression is sort of a compromised ability, partly, to do things on one's own behalf here. And of course, it's then connected to beliefs, as I mentioned before, quite dysfunctional beliefs. So the way that it shows up in lots of the families that we deal with, for example, the classic sort of horrible, dirty house kind of cases. They have to, it's not so much of the house being, I mean, sometimes there are safety issues there, occasionally. I think a lot of times it's just horrific the way that people are living. But the main indicator there is that people have given up even trying to establish any kind of order in their immediate environment. They can't take minimal care of their environment. They can't take minimal care of themselves. I mean, the capacity for self-care is compromised. And of course, all that is compounded when there is the experience of addiction as well. Then one has lost control. I mean, that's the kind of, by definition, the meaning of addiction. Someone has lost control of their ability to do the things or to not do the things that may actually endanger their lives there. So that has the thing that has to be restored then. So I want to say this again, the two main focuses, the goals in trauma treatment, whether this is with children or is with adults. It is to establish some kind of emotional regulation and so that the people have actually some idea about what to do on their own behalf that doesn't harm them more. Now, the problem with what happens a lot of times with trauma histories is that people eventually adopt strategies that in themselves are very harmful, and sometimes they're even life-endangering types of strategies. So, for example, cutting on oneself or dangerous driving under the influence of drugs and alcohol. I mean, all kind of things that people do to cope with that kind of emotional pain. So issues of emotional regulation and then issues of agency, issues having to do with the ability to do things for oneself. And so the key idea then for therapists, and it ought to be for all of you and for courts and for caseworkers as well, is that as when you are helping people to gradually, I'm going to say this again, to gradually recover from a very debilitating kind of condition there, is to give people choices. So why is empowerment practice so important in child welfare? And this is for both kids and for adults, because you gradually want people to regain the sense that that their feelings matter, what they care about the world matters, even though they don't always get their way. Nevertheless, people are interested in what their views are. And secondly, they can do things on their own behalf. They're not paralyzed. They're not apathetic in the face of threat. So the classic sort of trauma symptom at the very extreme, and this is a theme, and maybe some of you have read the Viktor Frankl book about man's search for meaning, about prisoners in death camps and labor camps in Germany and Austria during the Second War, is that apathy in the face of threat. That's the classic sort of paralysis that goes with trauma histories. And that is why, very difficult sometimes to engage people in treatment who have this way of presenting to the world, right? Because their deep-seated belief is whatever you have done that helps other people, it's not going to help me. It's one of those dysfunctional belief kind of things, right? So we're trying to help people, kids, regain the sense, some kind of emotional control over their emotional switches. We don't want people to be, we don't want kids to feel completely out of control of their emotions. And secondly, we want people to be able to do things on their own behalf, quite simple, straightforward things that are necessary to survive and function in the world, like asking for help, going to a food bank, seeking out care for dental need, all those kind of things. And of course, the thing about it is government bureaucracies are set up in a way to capitalize on that inability. So when you have people whose ability, whose capacity for agency has been deeply affected by their childhood, and then you just put up a barrier of red tape. I mean, it's hard to get through, get to anyone on the phone, a million issues with applications and all that kind of stuff. A lot of people just give up. And particularly if they have trauma histories, they just give up. So those are the two kind of, and so what I wanted to do, maybe I'll come back to this next month and we'll talk a little bit more then about sort of the issues there for parents who have dependency structure around them and so forth, and around what that means as far as their recovery process goes. So how do you help people recover the capacity to do positive things on their own behalf, not things that are going to harm them or kill them. Okay, I think with that I'll stop. I'm going to send, I mentioned to Ryan, I'm going to send a PowerPoint that's going to say something about burnout and secondary trauma and child welfare. And and this is a PowerPoint I did for child welfare staff quite a few years back. But this PowerPoint has a whole block of slides making some kind of the same points on trauma that I've made here in the last hour or so. And so some of it is quite relevant to the discussion here. And then I'll come back to some of the other themes. Maybe we'll continue with this and, when I come back to this next month here. So I think I'll stop.
Once again, Dee, thank you so much for presenting these to us, and we look forward to your next topic next month. So have a great
Okay.
weekend. Thanks,
Yeah.
everyone.